Hello everyone and welcome to Boccia England Boccia Beach webinar supporting server engagement and inclusive communication. This webinar is the second webinar in our Boccia Beach webinar series, which aims to support member collaboration and sustainable return to Boccia activity, both on and off the court. This evening, I'm delighted to be joined by Jess, Lorraine and Andy from Activity Alliance's partnership team. This evening, they will support you to do Activity Alliance's 10 principles to engage with more disabled people at the Boccia Club. So that's all from me. I'll now pass you over to Andy, who will start the presentation. Over to you, Andy.
Thanks, George. Good evening to everyone. And yeah, we'll just do, I know George has kind of stolen a lot of my thunder there, but just some quick introductions. Obviously, we do have Jess Cook on the call, and she's a strategic partnership advisor for the East and will be supporting us in the chat function. So again, do pop any questions into that space. And then, yeah, my name is Andrew Whitaker, and I'm the strategic partnership advisor for the Northeast and Northwest region, and we also have a partner in crime today, Lorraine Harris.
Hi everyone, so my name is Lorraine Harris and I cover the southwest of England, and yeah, we've been asked by Boccia England to deliver this workshop and to how to engage and communicate effectively with disabled people. So as George said, we want it to be really interactive. It's also a really safe space. So please feel free to ask any questions. No question is the wrong question or silly question. So feel free to kind of put any questions into the chat box, and I'll hand back to Andrew. And if I could please just ask also, just when you're not talking, just to keep your microphones switched off. That'd be great. Thank you.
Thank you very much. Are we okay to move on, Jess? Thank you very much. So Activity Alliance is a national charity, and our aim is to close the fairness gap between disabled people's level of activity and that of non-disabled people. So we're funded by Sport England to help tackle the inequalities disabled people face in sport and activity. And we look to do this via two main ways, which is changing attitudes towards disabled people in sport and activity and helping organisations to embed inclusive practices. Okay to move on, Jess? Feel a little bit like the government here tonight. Do bear with us. So again, I kind of let you guys read the slide there, but just to highlight that disability is an impairment or a long-term condition lasting 12 months plus. So for example, this could be people living with cancer or a mental health condition, for example. We'll move on, Jess. Thank you. Okay, so within the UK, there are two models that describe disability inclusion. The first approach can be traced back to the 1960s, with a specific term emerging in the UK around the 1980s. So the medical model says that access, attitude, perceptions are the fault of disabled people, and they have to change people's attitudes, and it's their responsibility to find a way up the stairs that you can see on the picture. So from the 1990s onwards, a new model was formed by disabled people. This is the social model. It says that the environment needs to change and be more inclusive. Access needs to be thought about as part of the design, and attitudes need to change to be more inclusive. So, okay to move on, thank you. Okay, so a little bit about the law. So released in October 2010, the Equality Act replaced the Disability Discrimination Act of 1995. And the Disability Discrimination Act has played a key role in driving inclusion in many aspects of disabled people's lives. As you can see, the law does make reference to reasonable adjustments in communication and activity. This means we all have a moral and a legal responsibility to ensure our communications and activities are as accessible as possible. And we'll explore co-designing as we go through the presentation. Okay, so a little bit of work That's enough from me. So we're going to hand it over to you guys. A little bit of work for you guys to do here. So we've got some statements on the screen, and hopefully this is where the interaction happens. So please feel free to pop your answers in the chat, or if you're feeling brave and you want to unmute yourself, then please do that also. So first statement, blind people don't use the internet. Do we think that's true or false?
False. False.
False? Exactly. I think we're gonna we've got a good crowd in tonight. I think we should be all right with these with it. So yeah, exactly right. Obviously, blind people use the internet as much as anyone with a disability impairment or not, and just utilize maybe technology to assist that. So if we go on to the next one, so deaf people can't access YouTube.
False.
We've gone with another false. Exactly. So within YouTube, obviously it has captions available, so that obviously you can put subtitles on your videos. And the next one, so the average reading age in the UK is 9.
True.
Joe, I think you've seen the answers, haven't you? Someone shared the slides with you.
No.
You're 3 for
No,
3
no,
so
no.
far.
No.
You're 3 for 3. Well done. So exactly, that's true. So yeah, we can move on from that one. So disabled people don't use social media.
False.
Joe, I think you should be in this position. We should swap seats. You're doing well there. So exactly right. Likewise, disabled people use social media as non-disabled people. The next one, you don't have any disabled people visiting your website.
False again.
False again. Exactly. Why wouldn't disabled people visit websites to find out information? Next one, we'll go PDFs are not accessible. I think you got this one, Joe.
False. Was it?
Exactly. Don't doubt yourself. You're doing well. Don't you doubt yourself. Exactly right. So we'll explore later on in the slides how we can ensure that we create accessible PDFs. So next one is accessibility is all about big fonts.
False again.
Exactly right. So yeah, exactly. We'll leave that one there. We'll move on to the last one, Joe. I think you can get a full house here. So disability is not my job.
False.
Exactly. You're exactly right there. So unfortunately, because we're not in the room, there's no physical prize, but well done for that. So yeah, appreciate the interaction there as well. So thank you. So yeah, just a question for people to consider. Do we know our audience? If we're okay to move on, Jess. That was a bit fancy. Let's understand our audience a bit further through research and insight. So the information on the next 4 slides is from the census data. Like us all, we're all waiting for the 2021 data to be updated if needed. But as you can see on the slide there, we've got the gender breakdown of 51% female, 49% male. Move on. So this is quite a busy slide. So obviously, as I'm talking, if you can just orientate around the slide, but just a couple of things to highlight. There's 13.9 million disabled people in the UK. Roughly about 8% of children have a disability. And then we're kind of about 19% of working age adults are disabled. So just to highlight the 21%, it says 11.5 million, and that's in the UK, and the average does stay about 21% across the other home countries as well. Okay, move on. Thank you. See, slick Jess there. So again, whilst you're looking at the slide, just to highlight some of the facts on the slide. Apart from Joe, not everybody knew maybe the region age was 9. But obviously everybody does now. So the Guardian has a reading age of 14 and the Sun has a reading age of 8. So it just brings it into a little bit of context around when we're putting out communication, are we making it accessible? And the research says 1 in 5 disabled people have never used the internet. So we need to ensure we communicate with individuals in different ways and that's accessible to them. Move on. Again, just another slide for you to have a look at. And are we failing disabled people? Is it right or fair that disabled people miss out? And are we understanding the full intersectionality of disabled people? So how disability cuts across different demographics. That's basically what we're saying there with the word intersectionality. And so, for example, we might support disabled people to access sport and activity, but maybe due to their religious beliefs, the activities still might not be accessible. So again, just things for us to consider when we're putting on sessions. Okay, so again, I'll let you kind of read the bullet points there with it. So just a little bit more information. 2 in 3 disabled people said they would listen to the GP, doctors and nurses about taking part in activity. And almost 3/4 of disabled people have more than one impairment. And the final one is almost 2/3 of disabled people said they rely on benefits to be active. So again, just to finish off with the final bullet point there around how do we ensure that we are co-producing with disabled people, so they'll help us to understand our audience. Okay, I'll hand over to Lorraine.
Okay, so we move on to barriers for disabled people. What do you think the biggest barrier is for disabled people? Physical or logical, logistical or psychological? Anybody have any thoughts? I'll help you out. Physical barriers are actually the most influential for disabled people. So 2/3 of disabled people are actually unaware of opportunities, or they believe there's a lack of opportunities actually available to them. They've got huge worries and fears around what non-disabled people think about a disabled person taking part in activities. And these barriers also go across these other areas, so the logistical and the physical. There is, if you think about your communications, are they accessible? And your equipment, is it right for the activity? And is the facility accessible? Is it in the right place? So these are all factors to look at when deciding that people look at when they decide whether they're attending an activity. So if you've got these things wrong and they've not been addressed, you've already not met their needs. And psychologically, and you've probably already lost them at that first stage of them contemplating, or maybe after they've attended their first session. If we move on to the next slide. So these next slides are relevant for where you are as a sport and hopefully interesting for you to see. They've come from the recent Boccia England Big Boccia survey, which was carried out in 2021, which you might have already heard of. It shows some interesting statistics around the demographics of individuals playing boccia. The highest percentages you can see there are for individuals taking part with a physical disability, and closely followed by those whose day-to-day activities are impacted by a substantial limiting health condition. So you probably already know this, but it also just supports you in your knowledge that boccia is an inclusive sport for everyone. It also shows the popularity of boccia amongst the 16 to 34-year-old age groups. So that's possibly something to think about when you're promoting your sessions and having them appealing to those age groups. And then the final stat on this slide is 38% of those individuals are actually permanently unable to work. Next slide, please. So not only do you have the statistic that 38% of participants are permanently unable to work, but you can see that 65% of those participants, I think, have we got the right slide up here? Slightly different. 65% slide, Jess? Yeah, that's the one. 65% of participants playing boccia actually say it's the only sport or activity that they do. And I think it shows that how boccia has a positive effect on participants. And those positive outcomes are not just based around being active, but actually around the social connections with others. It's a sport that can offer a wider audience a chance to gain new skills in developing coaching and volunteering. And by offering such a diverse number of opportunities for individuals, we also know that this obviously supports good mental health. And then we're on to the next slide, I think, that you went to show before, Jess, which was the 69% and the 54% and the impact of boccia. I think the slides might be slightly different to what, yeah, lovely. So we know that the dreaded COVID, the dreaded C word that we hate talking about, has had a huge impact on the population, but even more so with those with health inequalities or an impairment or disability. So recent research shows that 69% are actually still unable to play, and 54% have indicated that the pandemic has had a detrimental effect on their mental health. So kind of what I was saying before about giving opportunities to support that. The statistics on this slide just show how much of a positive impact and role that boccia has played in supporting these participants. 89% have said that it's had a positive effect on their daily lives and made them feel better about themselves. So something for you to think about as clubs: how do you support people to get back to activity? And I suppose how things have changed. It would be great to hear from one of you, maybe with a short example of this. So, you know, how did you support people to get back to activity and how have things changed? Anybody want to give us an example? It's fine if you don't. You can put it in the chat box if you don't feel like talking now, and we can maybe pick it up at the end. Absolutely fine. Feel free to put it in the chat box if you're feeling brave. So we'll talk about now the Activity Alliance 10 principles. They can be applied to any sport or physical activity and can support your clubs and coaches and volunteers and participants. I'll pass over to Andrew to talk about 10 principles. No, sorry, that's me, Andrew. No pressure. So the 10 principles are basically the things that people need to think to encourage disabled people to participate in activity. These are widely used in the sport and physical activity sector, and the Activity Alliance developed these principles in 2014 as a result of a bit of our research called Talk to Me research. And this research is around understanding how to increase participation in sport and physical activity amongst disabled people in the UK. So disabled people took part in this research, and the findings are based around what they told us. Jess can put the link to this research into the chat box if you want to have a look at it a little bit further. And also a link to the 10 principles, so you can have a look at those after the workshop. But we'll explore these 10 principles in more detail as we go along the presentation. Can we move on to the next slide, Jess? So next slide, Jess. Thank you. Brilliant. So drive awareness, very simple. Use the right communication channels. So this would be channels that people already trust. So just think about where people access information and how you present that information. And number two, simply put the activity in the right place. As we said before, is it accessible? Is it on bus routes, etc.? Okay, that's fine, Jess, we can use that one. So Andrew spoke earlier around the social model of disability. The language that we use shouldn't disable people, and we should ensure that disabled people choose a language that is right for them. So we've got on the screen in front of us some positive and some negative examples of the way in which language is used. So an example from above is using the language a disabled person. So it's not the disabled. This basically gives ownership to the person and is not focusing on the disability. So just have a quick look. I'll give you a second to have a look at what's on the screen and see if anything kind of surprises you. Anything that surprises you about any of these comments at all? No, I think the one thing that I would take away from today is maybe just to avoid the word the, like when you're referring to a disabled person, not the disabled, you're giving ownership to that person. So the other one as well is sufferer. People don't suffer from a disability. They suffer from a headache or they suffer from a cold. They don't suffer from a disability. So a cold or a headache will pass. And a disability you have for life. So you can't take medication to make it go away. And I'd say just one last thing to remember is language can really vary depending on where you are. So handicapped isn't used in the UK and we see that as being negative. Although handicapped is widely used across America and Europe. So it's just being aware. And again, you can see at the bottom of this slide, there's a little bit around the social and medical models of disability that Andrew spoke about earlier. Jess can put that in the chat if you'd like to have a look at that in a little bit more detail. It also kind of goes into the language that you're using as well. So next slide, Jess. Okay, so this slide shows some words that people use when they're talking about disabled people. Basically, avoid the right-hand side. Those are kind of negative comments. And there's really mixed opinion about the language that's used in the middle. I think there's some key things to remember. It's important to understand barriers within communication. So the language that you're using is really important. And basically, you probably all already know this, avoid terms that can convey the image of a disabled person as being helpless or dependent or pitied. And individuals have different preferences. So if in doubt, just ask. It will never be the wrong thing to do. So just that positive use of language and actually just consulting with people if you're unsure of kind of that language in what you're supposed to be using. This next slide, please, Jess. So there's some further examples here around barriers to communication. So as we were saying, the disability etiquette can be quite tricky. I worked on a project with the deaf community and it was basically always appreciated that I asked people's opinions. And if I did get it wrong, then it was okay. It didn't happen often because we basically had quite a good relationship of trust with the people that I was working with. And they kind of understood that it wasn't necessarily my world, but I was interested in learning and understanding. And I think that's the key to kind of building that trust. So as I said before, I think the best advice is to keep things simple and to really don't overcomplicate things and really don't be afraid to ask. I'm going to ask if anybody has an opinion on this statement. So to bring it alive a little bit, I'll read this statement to you. In our sports club, able-bodied love seeing the disabled join in around their club. So your thoughts on that statement? Do you think that's a positive statement or a negative statement? I think this kind of shows how if you just change the statement just a little bit, you can make it a lot more positive and not patronizing. So to me, that kind of seems a little bit patronizing, that example. Jess, can you just give the next example? So here we are is a good example. In our sports club, disabled and non-disabled people are actively encouraged to join in. So you can kind of see the different tone that that message gives. They're both talking about the same things, but just by having a completely different tone changes the way that it comes across. So use of plain English is sometimes forgotten. So remember what Andrew said earlier on is that the average reading age in the UK is around 9 years old. Plain English, as we've said on here, is about writing in a style that you can understand by reading it once. So not having to read that same sentence many, many times to be able to understand it. Again, we've got a really good example here. The first one is absolutely terrible, and I don't even know if I can get through that without messing up. So we have policies to abate instances of discrimination in our workplace. If you require the lodgement of a complaint, you should raise a matter with the anti-discrimination officer. I don't know, really, that's quite hard to understand. The statement underneath, our policy is to have a workplace free from discrimination. If you have a complaint, please tell our anti-discrimination officer. I think everybody that's kind of sat here will definitely think that the second example is kind of the choice that you should be using. Next slide, Jess. Oh, just back to the title slide, if you could, Jess. So the social model is huge, social media is huge, and there's many platforms now, and it's quite hard to keep up with what's out there, and it's ever evolving. So we'll run through a few basics, how you can understand kind of how to use social media to your best to be inclusive and how to reach a wider audience. Next slide, Jess. Okay, so firstly, every social media platform has accessibility features. So my tip of the day to you would just be to turn them on in your settings. If you do want us to run through that, or if you've got questions around how to find that, feel free to ask us after the presentation. And images should be used as much as possible to tell your stories. So we'll tell you a little bit more about alt text later on, and using alt text as a way to describe images. Videos, they can be easily subtitled. There's loads of free apps that make adding subtitles to your videos really easy. So just have a Google and you'll find something. Facebook and YouTube automatically add subtitles. So it's a really simple thing to do. And just make sure that you choose that option when you're promoting videos, because it's a really simple thing to do. And there's also an option of text-to-speech software. So this is basically, we've got an example here. It reads out a description of what you've typed. But one thing we're going to point out here is the overuse of emojis. Just be careful with the amount that you use. And we've got an example here that will bring that to life a little bit.
Frame I red heart emojis beaming face with smiling eyes grinning face with big eyes face with tears of joy grinning face with big eyes grinning face with big eyes grinning face with big eyes. But let's keep them down waving hand because they are very annoying weary face dizzy face person gesturing no for screen reader users smiling face with halo baby angel light skin tone baby angel medium dark skin tone baby angel dark skin tone baby angel medium skin tone. Relieved face folded hands here no evil monkey.
I like the no evil monkey bit at the end. So yeah, I think that brings to life kind of the overuse of emojis. I don't think it needs a lot of explaining. We actually think that's just quite funny as well to use within the presentation. So the next slide, as we move
Frame
on to
I red heart emoji.
Nope. Jess likes it so much she's going to play it again. And there's a little bit here on camel case. So camel case is when you're using a tag on something, and basically your words can get lost within that. So what we're showing here is actually the use of capitals when you start each word. So breaking the words up by using capitals, it just makes it stand out a little bit more and makes it a lot easier to read. You imagine if you were kind of looking at some of these examples and they were all in lowercase, it'd be a lot harder for you to kind of pull out, as on the bottom example there, for you to pull out individual words.
So from this slide, you can see a range of different fonts and styles. So a combination of clear font and good contrast is vital. And should use fonts such as Arial, Calibra, Century Gothic. But for the ones that don't know what they are, Jesse's highlighted them. They're the straight text, so without the little flicks. So look at using size font 12 as a minimum, as this makes it easier for people to read, a bit more comfortable, and the use of bold or size should be used to emphasize instead of underlining or italics, which could be a little bit more difficult to read. And also don't use underlining because it also can imply there might be a hyperlink as well, so it can make it a little bit confusing. Sorry, Jess, let's move on. Okay, so how easy is your communication to read? So just on here, I'll orientate you around the slide, and the pictures might be what someone who has colorblind vision might see, and also compared to someone who doesn't. So that's the pictures on the left hand side. And then just to the bottom of the page, you've got the colored text. And just to emphasize that this can be a barrier on the color of the text, and to ensure there's good contrast to make the text easier. So again, it just depends on what your background is. And then at the top of the slide in the box, text should read left to right. Unjustified text is easier to read due to consistent spacing, and justified is more tiring on the eye. So left aligned and not justified, or right aligned. And justified just creates white spaces, which, as I said, a bit more difficult to read. And then the rest of the text on the page, I can relate to this a little bit further with having dyslexia myself, but this could show an example of how someone with dyslexia may read a text, and actually around 10 to 15% of the population have dyslexia as well. So just to bear that in mind. We're okay to move on, Jess? Thank you very much. Again, just whilst you're looking at the pictures, I'll just highlight a few things. So the first picture, text over image. So this could be made more accessible by putting a bold box around the picture to highlight the text. But again, as you can see there, it is very difficult to read there. And then the second picture is quite difficult to follow, so don't rely just on colors. Could we also use shapes as well to help to differentiate? And the third picture is sensory overload, so too much information there. Again, just let's highlight the information that people need to know. And the fourth one, let's think about the pictures we're using. What do they say to you? But most importantly, what do they say to your target audience? So again, let's make sure we've got positive pictures. Again, another question for you to just answer to yourselves. And then we're going to move on to some inclusive formats. So the next slide is a range of formats that can help you to communicate with your audience, and also to ensure that a communication budget is built in. So I'll just run through a few of these. So audio description, this is used for deaf people, but it's expensive and needs to be done by a professional company. And BSL interpretation of videos, these are also expensive, but if you work with an audience that needs this, it's a good practice to include. Captioning and subtitles, these should always be used on any film you're producing, either in-house or by a company or students. Subtitles in the main are free, and there's programs available on the internet to do this. Again, Makaton is utilized by mainly young people living with autism. Easy Read, we'll talk about that a little bit further in the slides. And again, telephone and text message, a fast and inexpensive way of instant communication with it. So plain text versions of emails and flyers. So if you're using a designed newsletter, can we make sure that you have a plain text version in Word? As again, this doesn't cost you any money and can be sent out as an alternative format. And then we're going to move on to accessible PDFs and Word documents in the next slide. So in Microsoft Word, there is an accessible checker. So in predating Windows 2010, that's what you can see on the screen now, and you'd access that via the file option, info, inspect documents, and then obviously you can see there check accessible checker. If you've upgraded to anything 2010 onwards or Office 365, then hopefully this is what you see, and you should be able to see it now embedded across the top in the ribbon under review, and then you'll see a box will break out on the right hand side of the screen, and it'll be able to tell you how accessible the document is and what requirements you need to change. The pitch comes after. Okay, so if you're using images in any documents, you should have add alt text, as it says there. This enables a screen reader to know that there's an image and describe what the image is. So to do this, you right click on the image and you'll see alt text. Don't worry about the title, just add a description. There we go, in the new version. So again, anything Windows 2010 onwards, in the new version of Word, it's very clever and it does it for you. So as you can see, the alt text is in the ribbon, and Word automatically knows that this was a dog, so I did the description for me, as you can see on the right hand side of the screen. Brilliant. And again, how to create accessible PDFs. So as you can see on the slide, you can create accessible PDFs, but you need to ensure you have the contents page, that that your page has a hierarchy. So use headings, subheadings leading into the text. Also, again, make sure you use the alt text for pictures and remove any tags. Another format is Easy Read. I said we'd highlight this. So this slide is an example of Easy Read, and it breaks information down into sentences per point and is accompanied by a picture relevant to the sentence. So again, maybe could the Boccia clubs have policies that are accessible for all? So lots of things to think about, but a really nice checklist. So I'll let you read this. I'll not read them, all of them off the slide. But again, just maybe things to think about is mixing up your channels. If we put posters in a leisure centre, that might not always be the best place to get new people. Again, how do we use technology? We've just talked about Microsoft Word and the accessible functions that are available there. But again, towards the bottom of the slide there, you can see around co-production and ensuring that current Boccia members can actually help you to co-design more accessible communication. So the next one is inclusive communication in action. So again, this next slide is just looking at the 10 principles. And we just touched on it a second ago around, can the activity be in a location I'm confident in attending? Again, you can see in the text there in the blue text from Elizabeth, and sorry, Jess, around kind of some ideas around how to make it a little bit more accessible for Elizabeth, because she's asking the questions. And I think that's it from me. Yep, I will hand back to Lorraine.
Yep, so engaging the audience, coming from a coaching background, this is probably my favourite topic to talk about. Can we do the next slide, Jess? Lovely. So what are the benefits of engagement? It's a massive topic, and it's not just around engaging disabled people, but it's also around your recruitment, your workforce development, and your market research. So this is an example here on the screen of the ladder of engagement. You might have heard of similar toolkits. So there's another one called the ladder of participation. This ladder will basically help you to get a feel of where you currently are with your work with disabled people, and then where you might like to get to. And it can help you understand where you are with where your stakeholders and your partners sit within that ladder, and therefore also how to improve your engagement with them. You can take it away and have a think about disabled people and your work as a Boccia club and how you currently engage with them, and then kind of have a look at all of those areas, and then look at areas for improvement. It would be great, again, if you could share that back with Boccia England. We always like to know the impact the workshops have across our networks, so it would just be nice to see kind of where you've come from, and maybe kind of your plans for improvement. We can go to the next slide. So within your improvement plans, there's some stuff that can help you here. These are our engagement fact sheets, which can also support kind of with that planning of the ladder. And it also breaks down into specific audiences. So if you're looking at children and young people, working with older people, Jess will put both the engagement PDF and the link to these resources in the chat for you to have a little look at. Don't expect you to remember everything that's on the screen. Next slide. So back to the 10 principles. So to engage your audience, don't focus solely on disability. Next slide, Jess. Not only doesn't it build confidence in the participants, but it will also limit the audiences of people that you would like coming along to your sessions. I think many people don't identify with being disabled and are actually put off by advertising that solely focuses on disability. So it could be really tricky to ask everybody what their preference is when you're promoting, but I think mixing up the language can help, and asking the person what they would like. So when you're looking at your advertising, leading with words about the session being for disabled people will put people off attending. We know from our research that a lot of people with a disability want to be part of a session with their friends or family, and not actually part of a session which is specifically aimed at disability. Next slide, Jess. So I think what I'm trying to say is think of your unique selling point as a club. This is a case study here from a Boccia club in North Devon for individuals with learning disabilities. And they basically wanted to develop it was a new club that they wanted to develop. And being a new club, it was basically difficult for them to get the parents and carers to support. So they saw the sessions as being an opportunity to have a rest in the cafe whilst waiting for the sessions to come to an end. So the club needed to think of ways of supporting the sessions because they had a lack of coaches. So they changed tact, and instead of being focused on the competitive pathways that the Special Olympics offers, they opened up the sessions to family and friends, and they set up really informal have-a-go activities. And as a result of this, because the session was kind of more relaxed and informal, the parents and carers started to get involved because they weren't worried about needing specific coaching skills to support people. And then working on that, where an informal training was then offered to them. So kind of as a byproduct, they became volunteers, even though it's kind of through participation. So if you're looking at something to take away from this case study, it's that they found their unique selling point by changing tact and as a fashion. and kind of giving the right choice to people and giving a variety of choices. Next slide, Jess. So linked to individual values and appeal to different values over time. So this slide comes from research that tells us what disabled people say is important to them, their values and what they look for in life. And although this is really helpful to look at and reflect on and kind of understand some of those areas, it's also really helpful to consider that these values, they change over time. So what's important to someone like getting fitter might change in a few months, and making friends might be the value that they need at that particular time. So you just need to be aware of this, and that also helps with ensuring people don't get bored. And that is really about having, what we were saying before, about having that relationship of openness and understanding. It's so important. So don't assume that you know what they need or what they want. I think it's taking the time to really understand their values and their likes or dislikes. Like we said on the slide before, focusing on fun and enjoyment and what people can do rather than what they can't do. And I think by doing that, you can tailor what you're offering to actually what they want to take from a session. So another thing, you can find out about activities that they might be interested in but not manage to have time to actually, or an opportunity to take part in those activities. And when you're promoting the in-session, instead of, if you want to make it inclusive, you can promote how inclusive and accessible an activity is in other ways, except for using kind of words that say, you know, our session is inclusive or our session is open to those with a disability. So you could just put stuff on that, for example, accessible toilets on site, the cafe has large print menus, or the centre has a hearing loop. And again, people will respond to images that look like them. So maybe ask your existing participants whether they mind their images being used on the advertising. And like we said before, just keep in mind, be flexible. So what's important to people now might no longer be a priority, and that's really important post-COVID. Your sessions might be the only interaction that people have had. So really promoting that social element is a great idea, and especially like if you've got a cafe on site, you could include that on some of your advertising. Moving on to the next slide.
That's back to me. So yeah, obviously back to continuing on the 10 principles. We've got number 6, so reassure them they can do it and reassure they will fit in. So if we're okay to move on. So some people have a fear of standing out, and they need to feel welcomed and reassured that their ability or age will not be a barrier to taking part. So think about offering additional support to participants attending their first session, including practical information and help to access the session and the facility. So a few things just to consider: make activities accessible to all, having a mix of abilities, taking part is useful. Lorraine's already stole my thunder around the have a go days, so we'll not say that one again. Look at how buddies and support mentors can help potentially there, and show you care by offering the additional support and providing information in alternative formats, which is what this evening's session is about. So just maybe a question that a new member might have is around kind of what is Boccia and what will I be doing. So as Lorraine mentioned, make sure that we're kind of asking them questions with it. Enough of my voice. We have a short video on the next slide that has been pulled together by the North Devon Boccia Club.
North Devon, a friendly, inclusive club that welcomes new members. The car park is located next to the Tarka Tennis Centre. It has plenty of accessible spaces and only 40p for an hour. There are friendly reception staff to greet you on arrival and answer any queries you may have. They'll also direct you to where the session is taking place. There are fully accessible toilets, plus male and female changing facilities. Snacks and refreshments are on offer, plus a large seating area for you to relax after the session. You'll be greeted by one of our friendly volunteers. We ask for a voluntary donation of £2 per session. There are lots of sports on offer, including boccia, which is a bit like bowls but played from a seated position with softer balls. This is one of our most popular sports and is inclusive for all participants. There are other more active sports, such as tennis and table tennis. Sports are rotated on a weekly basis to ensure everybody has a chance to do something they enjoy. All of our coaches are volunteers, a friendly face to greet you each week and make you feel at ease. We like to say thank you to our volunteers by providing them with lots of training and development opportunities. Why don't you come along and see for yourself? Every Saturday from 12:30 to 1:30 at the Tarka Tennis Centre, Barnstaple. We look forward to meeting you.
Thanks, Jess. So that was just created by a simple free app, and you might have recognised Lorraine doing the voiceover in her previous role. So if we're okay to carry on. So allow people to feedback. So what does that mean? So how do we ensure we've created a co-designed environment? Do we have players and parent reps within our committees? So utilising the skills and attributes that people can bring as members. And then when a disabled person attends a session, allow time and space for feedback. This will help to support co-design. So allow that time and space, but that's also relevant for supporters and carers who sometimes also need that time to discuss either private, personal things that are happening. So again, just creating that really safe and inclusive environment. Be welcoming. So like everyone, when we go somewhere new, for the first time, it can be scary. It can make you nervous. So when you have a disability, these are the same worries as well. So I think you think you're going to stick out or not know where you're going. So having a new member to a club to welcome new participants, to give them a rundown, show them where to change and take them directly to the instructor coaches can be make such a difference. Number 10, yep. So encourage me via my existing advocacy. So what does this mean? So I've mentioned buddies already, but it can be a really great free resource within your boccia club. Those that have been new participants and now love the sessions are great advocates and buddies for beginners. So let them share the journey. Maybe have participation profiles on your website, and these will help to advocate and reassure new participants. And then I'm going to hand back to Lorraine for the last few slides for today.
Thanks, Andy. So yeah, just on to a little bit around resources. The Activity Alliance have a huge selection of resources, which Jess has been busy adding to the chat throughout the workshop. So we can forward these on to Boccia England after the workshop. This slide shows our club hub, and you can use this to check and challenge yourself as a club. The tool's been created to help include more disabled people in their activities, and it can be used in a variety of ways throughout your club. There's 5 stages: activities, people management, promotion and volunteering. And basically this will give you ideas and methods and resources, and to ensure that everybody has a positive experience in your clubs. And it can also support your workforce being more diverse and give you ideas on how to develop opportunities for disabled people within your sessions, to develop their own skills and knowledge as well. Next slide, Jess. And you can find details of all of the strategic partnership advisors, if you'd like to email, the email address is info@Activity Alliance. There's 4 other Andrews and me based around the UK. Feel free to contact us on that email address there. We're all really friendly and knowledgeable, and we'll help you with any questions where needed. Yeah, and so from me on behalf of Andrew and Jess, I'd just like to say thank you to everyone for your time. We'd love to hear your feedback. So if you do have some comments, and please feel free to email Boccia England with them, because that just helps us to shape future workshops as well. So yeah, I'd like to say thank you again. I think we've finished with a little bit of time to spare. So I'd just like to say to everyone, have a great evening. And if you do have any questions, we'll quickly field them, or feel free to kind of say goodbye. And thanks for your time.